rheumatoid arthritis. If you've got it, you almost certainly know that it's painful. Getting a diagnosis can be a challenge, but when you do, the right treatment can make a real difference.
I had 2 bad flare-ups. What happened, just through clapping, went to a show to see my granddaughter, and the following morning, my 2 hands was up like balloons and very painful.
I've had an operation on this knee, but I got the other one going now, and my shoulders, and I'm in agony all the time.
It's one of the big bugbears of life, which affects you in so many different ways. Sometimes you feel fine, other times you feel absolutely lousy.
I had terrific pain in my wrists, and I was back and forth to the doctors for several months.
Since September, I've had 40 blood tests. I've even had echocardiogram because they couldn't find what was wrong with me. Sorry, I guess.
One of the problems is that non-rheumatologists have difficulty in recognising inflammatory arthritis. There is a problem with recognising these symptoms. It can take a very long time.
It was a terrible diagnosis to receive about 30 years ago, but since then we have so many medications and you can go on to live a normal life without any disability or deformity.
There's a standard pathway for treating a newly diagnosed rheumatoid arthritis patient. You would put them onto steroids and then methotrexate unless there's a contraindication to giving them that. And then you use a fixed dose of methotrexate, and then if that isn't successful, you add in other medications on top like hydroxychloroquine and cilazapine.
It's a pain that nobody else knows unless you have rheumatoid arthritis. And to be out of that pain is, well, freedom, and it's marvellous, you know, and I've got Dr. Bevan and his team to thank for that.
The expectation these days is that you will have a very good response to treatment and feel, significantly better.
It's an autoimmune disease, which means that your body attacks the lining of the membranes surrounding your joints, causing inflammation and pain.
It can affect all your joints, including your neck, and also sometimes the eyes. It can cause erosions in the cornea.
I know when it's going to start because it's like, like if you strained your wrist. It's like that, and then it goes into your hand then, and my hand was nearly double the size, and the pain is horrific.
The first line of medication that we normally give to patients are steroids. It controls the disease, but it doesn't take it away.
I have had a steroid injection, which I found excellent, but you can't have too many of those. But that was very good, because within, well, I would say half a day, I was right as rain.
The next line of medications are called disease-modifying agents. Methotrexate is the most common DMARD that we use, and it's the mainstay of treatment. But there are other drugs such as sulfasalazine, hydroxychloroquine, leflunomide, that can be used as well, and it depends on the patient. Go take a seat. So can you tell me what medications you're taking?
Methotrexate.
Okay.
And the hydroxychloroquine.
Okay. Now going back to methotrexate, how many tablets do you take?
I take 8, once a week.
Okay. Yeah. Any problems with that? Any side effects?
No, nothing.
Because you can have side effects like mouth ulcers, diarrhea,
yes,
shortness of breath. But luckily you have not experienced any of those, which is great.
Nothing.
Okay. And when do you take your folic acid?
I take that 3 days later.
How many hydroxychloroquine tablets are you taking?
One every day.
One every day?
Yes.
Okay. And have you had your eyes tested yet?
Yes.
Leon started his treatment on methotrexate, but just couldn't get on with it.
You were on methotrexate before?
Yeah. I was getting more areas of my body, flare-ups, more arthritis coming in there. I was getting stomach problems from the tablets themselves, so I wasn't eating as much.
Did you have any mouth ulcers on it?
I did have some ulcers in that period as well.
Sometimes people do experience side effects on methotrexate, and that's why we have so many drugs.
Yeah,
and now that we moved on to the next line, it sounds like things are so much better for you. Is that
perfect. Right? Life-changing, if anything. I got a little girl, I can run and all manner of things might look going on.
Leon is now on a class of drugs called biologics.
Some of the biologics that we give are given as infusions. So it means that you go to our day unit, you may end up staying there for half a day or full day sometimes, and receive the medication in your vein. And that's a very effective way of giving the drugs.
Well, I've been on this treatment for approximately 4 years. And out of 20-something medications, this has about been the only one that's agreed with me. I'd say to anyone, don't worry. You know, just it's trial and error. You know, just keep cracking on with it, because at the end of the day, you'll find something that'll actually be of benefit to you.
I've been put on biologics recently for the past 2 years and it's been fantastic. I haven't had a problem since. I have it once a week at home. They live in the fridge, being live biologics, and delivered to my house so easy. I haven't got to wait for anything, and that's it, it's brilliant.
The final key to controlling rheumatoid arthritis is making sure that you take your medication.
If you don't listen to what they say, or don't waste your time, you're not doing yourself any good.
Literally, you've got to just carry on.
I wish I didn't have to take them, but I do know that they put the fire out in the body, for want of a better word, and the way I speak, they put the fire out in the body.
In partnership with your medical team, you have every chance of putting the fire out and living as well as possible with rheumatoid arthritis.